We're at the 25th CROI in Boston. We're with Leandro Mena, who is with the University of Mississippi
Medical
Center, and we're going to be talking about PrEP. We have successful PrEP. Now what? I guess that's the way to
exactly.
put it.
So I mean, yeah, absolutely. Science, is clear. PrEP works. Certainly it works well for men who assist with men, who are the population that is most disproportionately affected by the HIV epidemic, at least in the United States and Europe. The challenge that we have ahead of us, and data from this conference that is being presented, by colleagues like Aaron Ziegler, Patrick Sullivan, Don Smith, points out to the possibility, that this tool that is so amazing, that can really, prevent, HIV infection, can also, because of the disparities that exist in terms of access, can end up, deepening the disparities that exist in our country in HIV infection rates.
So the thing is, we've had antivirals that worked for years. We know that they work, and yet people don't access them. We have 50% of the people don't use it in our country. We have now we have PrEP that works. It seems like we always have the tools. We had condoms, people wouldn't use them. So I mean, not everyone, but most people. And so for that reason, this epidemic persists. And I don't know. I think that's the big question that you're pushing out there, is what do we do? How do we implement it? How do we get the governments of various countries to understand that this is a solution, if they were only to implement it in a broad and dramatic way?
Yeah, so. Absolutely. I agree with you. I mean, I think we have these tools, and I think the challenges, are not very different for PrEP to reach, those individuals who may be at highest risk, as the challenges that we have, to link to care, to diagnose, link to care, and taking care, those individuals who we know are disproportionately affected by HIV. I think, what we have to think, is a little bit more upstream in terms of how do we, change our healthcare systems. I mean, to be more responsive to the needs, of those individuals, and address, some of the barriers that these individuals have. I mean, certainly there is a common denominator in terms of in both sides of the continuum of care, of the prevention and the care, where you find, poverty, when you find, lack of education, and certainly, lack of health literacy, to navigate our complicated healthcare system.
So, being that they're not illiterate, but less than illiterate, and not in a position to really understand the importance of the science and how important it actually, the message it actually, the questions it actually answers, and the messages it provokes. It's kind of a spiraling down. It just doesn't seem that anyone has enough understanding of the science to say, okay, we have to understand science. We have to understand that it answers questions. But unless we implement that science,
correct,
we're really lost.
Right. I mean, I think we need systems. I mean, we need to help people to understand how our healthcare system works. I mean, and things are simple. I mean, I can give you an example. I have patients. One of the most common reasons why my patients will miss medication is because once you start on medication, very often they are they receive the medications, on the mail, so they don't have to worry about going to the pharmacy. But most of them, even when you tell them, don't really understand that they have to call the pharmacy to get refilled, because the first medication comes to them automatically.
Oh, right.
They assume that everything is. So
this is just one circumstance that could end up being actually detrimental, because you don't want to have them build resistance to the drug because they didn't get it refilled.
Right. Yeah, that's relevant with HIV infection. A little bit less relevant with PrEP. But it's a situation that kind of points out a simple thing, for which some basic understanding, of how the healthcare system works. How do you refill your medications? I mean, very often.
It'll be more so because of the PrEP, because that's something that's less. It's more elusive, but we tell people they have to take their medications every day. When the PrEP is gone, they think, well, okay, maybe I don't need it anymore. They don't understand that they have to, if they're going to take it when they're at risk.
Right. I mean, with the PrEP, you have healthy individuals, who very often don't perceive themselves at risk, or underestimate at least the risk. So whenever you find, minor kind of bumps, on the road to PrEP, very easily people kind of turn around and say, I don't need this.
Right.
So,
Right. So it's important for them. Now, what we do is education for the public and for the community and the people at risk, and we want to make sure that they understand the things that we're talking about. So we do this for that reason, and I don't presume to think that we're the only answer, but more of this kind of thing needs to happen, and we have to get it in ways that it's digestible for every population, that every single population understands in a way that they can understand it. It has to be in their cultural lexicon. So if we can do that kind of education, drag them kicking and screaming into meetings or whatever, and just say, okay, we're going to feed you, but you're going to listen to this because this is very important for your life. And I think the other thing is people don't understand that there's a risk of dying still, not necessarily of AIDS, but of AIDS complications still today.
Well, HIV has become a manageable, chronic disease, and it's interesting because in my position, I care for both HIV negative individuals and HIV infected individuals. And very often, some of my HIV uninfected individuals become HIV infected. So I have to, talk to them when they are uninfected and advising about, the importance of not getting HIV infected. And at the same time, once they become HIV infected, my message needs to be consistent and make sure that they understand that hope is there, that HIV is no longer what it used to be, and that they can live total normal lives. Right. I mean, but at the same time, you have to, balance that message.
But it's always, I think, somehow or another, we have to get the message across that it's better to not have the virus seed every cell in your body,
right,
as opposed to being prevented from that happening.
Well,
it's really a great opportunity.
What I tell my patients, I learned from some of my friends who are HIV infected, and one of them told me, I have not met one single person, in spite of all the advances, that rather be HIV positive.
Yeah.
I mean, so that's enough to do whatever you can
that should be
to
enough
stay
of
HIV negative.
Of a push in the right direction. So I think the messaging is important, and I think we have to find ways to create those messages for each specific population in their language, in their cultural ways, and in their sense of trends. They get into these trends and thinking, like you say, that, HIV is not a big deal anymore. Well, it still is for, you can still die of the complications today. Right. I mean, it's manageable if you take the treatments. But if you don't take the treatments, it's not manageable.
Right, and also, besides the complication, there is, significant stigma out there, and there are some people who are in very vulnerable positions, that can be affected by that,
being
stigma.
Seen taking either the PrEP or the pills.
Right.
The HIV
well,
pills.
yeah. Mm-hmm.
Well, it's always a challenge. We never seem to have a simple answer, but I think it's in the complexity of it. It tells us that we have to do a lot to answer the question, to get the people to take the treatments and the prevention.
Absolutely. I think the great thing is that we couldn't believe in better times. When it comes to how effective are the tools we have.
Efficacy is fine if you take it.
Yeah, and I think the challenge that we have ahead of us is actually again. Coming up with the systems and methods, to make sure that those individuals who need it the most actually can have access to it and are using it.
And at the very least, the people who are most needful, the groups or the clusters, as they say, are the ones that need to get it first, and then spread out from there to the less at risk. I thank you so much for being here with us. It's great to have you talk on this, and I hope that this panel will be exciting.
Thank you for having me. Pleasure. Thanks.